New blood pressure guidelines now categorize nearly half of all Americans with high blood pressure.
And Arkansas is no exception. Channel 7's Matt Mershon is here now with more on the reasons behind that change. Matt?
Chris and Beth, the biggest change has to do with Americans previously diagnosed with pre-hypertension. That's roughly 30 million Americans, and now they're all considered to have high blood pressure. The change all having to do with preventing some of the deadliest diseases in the U.S.
All right, go ahead.
Megan Kempker, an employee at the Arkansas Heart Hospital, wanted to check her blood pressure to make sure she's not one of the 30 million Americans now classified as having high blood pressure.
I had my blood pressure checked. It was probably last month.
Turns out she's just below the new guidelines set out by the American Heart Association, categorizing those with a blood pressure of 130/80 or higher to be in stage 1 hypertension.
Well, I think it would be a little nerve-wracking. Like if you do have high blood pressure, how would you control that to get it lower?
And that's the goal of the new blood pressure guidelines. Cardiologist Dr. Paixao says the hope is by lowering the threshold for high blood pressure, it'll help warn more people that they're at risk for developing major health issues.
Any blood vessel can develop disease, and that can affect the brains, can affect your legs, and can affect your heart. These are the main things that we're trying to prevent when we're treating someone's blood pressure.
While the new guidelines may result in more Americans being put on blood pressure medication, Paixao says the suggestion for most of those newly diagnosed with high blood pressure is
exercising more, having a healthier diet, and just without medications, lowering their blood pressure and improving their overall health.
Tonight, a healthy blood pressure is now considered to be 120/80. I'm not included in that, Chris.
Maybe a lot of us aren't, Matt. Thanks so much. Arkansas does rank among the top 5 states in the U.S. for the worst cardiovascular mortality rates.